on.
How old are you?
43.
43. Okay, so before you do, please ask always what she have done, especially the important one is filler and the fat graft. Okay, so anything done here? No. Okay, good. Anything done? Filler?
2 years ago.
2 years ago, which area?
ที่ดับไฟทุกตรงนี้
I think he does me
Okay.
what
ไฟมันเข้าจอ
Okay. But I can see here not much filler remaining, so no problem. But she looks like I have a little bit of the dark circle, right? And this area is sunken. So this area will be our good target. She will have an improvement. And also she has this line here. You see the Indian lines. And she also have this nasolabial fold. Okay, and also of course she has this one. So we're going to use, for the ultra cold lifting, we're going to use here about 1 cc. And if you want to improve the nasolabial fold, we will use another 1 cc. And if you want to improve here, another 1 cc. So maybe 1.5 bottle, okay? 1.5 bottle, because we mix 4 cc. So we have 1 cc, 1 cc, 1 cc.
You will start the Tridem or Tridem first.
Tridem first. Okay, then we do this area Tridem, okay? You see this bulky area here? So we can do the Tridem. Marking, yes. You see the marionette line? So we do something like this. Okay, can you show to the video? Okay, can you see the design? Yeah. The bulging area. But if you see carefully, this area is a little bit sunken. Most of the ladies, unless it's too fat, this area is sunken, and this area is sagging and with some fat. So this is a good area to use the Tridem, okay, the RF cannula. Okay, the other side. So how to design? You see the marionette line. So follow the marionette line, and to the backward, we will do the RF cannula. Okay, so this is the easiest design. If you're going to do the RF cannula for the nasolabial fold, the design will be something like this. Okay, something like this. We have this, so she will do Tridem and ultra core. Tridem and thread lifting. Ultra core, which? Okay, then ultra core we will do under the eye. We do the RF cannula and the thread. Okay, so this is the usual design. You know, about some patient, we have this here, prominent area, then you can do up to here. Okay, so the concept here, we do reduce something like this, and then combine the thread. Also the concept here, we reduce here something. I mean, we melt the fat a little bit, reduce here, then combine the thread. Okay. Okay, so we will do the RF cannula. Give me the lidocaine with the epinephrine. Lidocaine with the epinephrine.
So, Dr. Kwan, for the anesthesia, what is the benefit that you use the local anesthesia than the nerve block?
Yeah, because this one, I emphasize the epinephrine because the local area, we are doing a lot of dissection. So to minimize the bruise and the bleeding,
okay.
Yes. The very important is the lidocaine with the epinephrine. So no need to do the local block. Okay, give me that. Come closer.
ใกล้ๆเลยครับ เดี๋ยวเขาหยิบเอง เขาชอบหยิบเอง
This is a at the back. No switch at the back. Okay, so this is a lidocaine with the epinephrine. This will be your entry point. So we do one entry point, and then we're going to shoot. And this is a 32G Botox syringe, so you can inject. So it's easy just to shoot all the areas with a lidocaine, with the epinephrine. And you have to wait to finish. Also here, this will be your entry point. And this will be another entry point here. More. We need more. Okay. Then we can do the other side as well. It's easy, okay? The design is not that difficult. The bulging area, you can just make a design. One more. Okay, so the entry point will be here. So we're going to do all the way. One more. So our air inside. Okay. Somebody can push this way. If there is the thin one, you can push and they come out very fast. Cannula cap. Okay. 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 because for the thread. Okay, so we're done. Puncture with a 20G needle. Or if you don't have, of course, we have to use 18G. 20, yes, I need a 20. Okay, then we make a puncture with a 18G. Give me the RF cannula. Sorry. Can I show this way? Okay, as you can see here, there is a RF cannula and RF acne and plasma. So there are three functions. So we do the RF cannula, usually do power 7, okay? And the under the eye power 6. It's too strong compared to previous model. So yeah, here when you put the ready, then you press with your foot, then you can see the timer goes up, okay? Okay, so we are ready to do. You put here patch, and you have to put the patch here. You have to put the patch here. Yeah, here you have to put the patch. Yeah, and then need a cannula. So this is a new? Yes. New? Okay. So this is the, and at the tip, RF comes out. Okay, at the tip. Okay, so can you pull here? No, stay here, stay here. Can you pull here? Can you pull here? Yeah, if your assistant stretch a little bit, that will be of help. And then let's start. Can you hear the sound? Then if you hear the sound, the RF is going in. Anybody wants to feel? You want to feel?
So Dr. Kwon, the cannula size and length.
This is a 5 cm, 21G cannula. Okay, give me 2 fingers. Okay, so here is one doctor. She can try. Can you feel? It's stiff, but after few stroke, yeah, superficial, you can feel now getting smoother, right? Yeah, so actually after 2 or 3 stroke, if the patient didn't do anything, it's very, very smooth inside. But some patients do many treatment, a little bit more fibrotic. So
So what is the endpoint sign?
Endpoint, usually time is also endpoint. Don't do more than 2 minutes in my opinion. And also when you feel inside is smoother, now there is a resistance, but now there is no resistance. So that is usually endpoint because doing too much is not good.
So you do it not more than 2 minutes, but meet the sign of loosening side, right?
Yeah.
It's really-
Just in case some patient very fibrotic inside, you want to do more than 2 minutes, then you make one more puncture here, go a little bit crisscross. That is much better than just do one puncture, do 3 minutes like that. Okay. Okay. You can do 3 minutes, but you make another puncture here and do this way. I will show you. Let's say you make another puncture here. Another puncture here, then do this way. How do you feel? Is it smoother, right? Actually, still we are on the subdermal layer, okay? We don't go too deep. And this is the marionette line. So actually we have to do a little bit more here to reduce the marionette line here, you see? We do this way to reduce the marionette line. So in total, we have done 2 minutes, okay? Now exactly 2 minutes. And then here, the nasal labial fold. Nasolabial fold. Okay, we made a puncture here. Can you pull here a little bit? So if your assistant pull a little bit like this, it will be much better and easier. So we're going to do this area, okay? It's quite fibrotic. Can touch. It's quite fibrotic, but after a few strokes, it will become very smooth. So with your left finger, you can push down, okay? So it's much easier to do, especially this area. Because many ladies like this looks ugly, so we're going to bring down like this. It looks much more prettier, okay? The nose looks more higher too. Thank you. See, this is the area, the ligament, so it's very stiff, right? Can you feel it? Yeah. So actually, we have to destroy this ligament. I mean, not destroy, but we have to clean up, go up on the ligament to improve the Indian lines. Okay, so we did here about 1 minute, so I'm changing another area here. I made a puncture here. Here, pull. Not too much. Okay, that's good. So we go in here. Yeah, here, can you see it's quite fibrotic? So we're going to release the fibrotic area adhesions. So we're going to release the adhesions. Then we can put, let's say, thread or ultra core. Then we can make it a lot better shape. Okay, here, yes. Okay, so let's compare the right side and left side. Can you see the lines become a little bit smoother?
Zoom out หน่อยครับ Okay.
Yeah, smoother. I can say it's a smoother, okay? So this side is more smoother than this side, okay? Then if we put the thread, then the effect will be more additional effect. But you do this one and you do thread, you don't do this RF and you do thread, the result is different. Okay? So we do the thread. Can you give me the thread?
So Dr. Kwan, some doctor do like this but cannot meet the result like this. What is the problem? They cannot see the lifting effect immediately. What is
Because
the
you
problem?
didn't do the RF cannula dissection properly. Maybe it was too deep. I always mention to you, we handle the subdermal layer, all the lifting is there. We don't have to go deep into the mass, or you don't have to go into the muscle layer, no need. We handle right below the skin, then actually all the lifting and all the skin rejuvenation is there.
So for this point do the right plane นะครับแค่สับเดอร์มอลเท่านั้นนะครับ
Okay, I will make the design. Give me the pen. Okay, so as you have seen our technique, tragus 1 cm, 2 cm, 3 cm in front. So this will be our entry point, and then 1 cm below, 1 cm below. Okay, so we usually put 3 or 2. Okay, she has a little bit swelling here, and also here lateral canthus to upper border of the ear, we make a straight line, and at the meeting with the hairline. So 1, 2, 3. Okay, so we're going to put 3 thread lower and 3 thread in the mid area. So it's quite easy, okay? Please remember. Of course, then we here the lips up to the lower jaw area. In the middle, we make 1 point, 1 cm below, 1 cm up. So this one we connect. Okay, so we're going to do 3 thread like this. Okay, do not put too close to the lips, okay? Because the lips always moving a lot, so the thread might be displaced to somewhere else. So, and then here, nasolabial fold, you have the nasolabial fold here. So, one in the very close to the nasal border, 2, 1 cm, 3 cm. Also same, do not put near to the lips, okay? At least 1 cm apart. Then you're going to connect the middle one here like this. Okay, so it's easy. Because by the putting the thread alone, you already have the lifting. Give me the little cane. So we usually do entry point, lidocaine with epinephrine, entry point, if you you want to reduce the pain, follow the lines, okay? Follow the lines. You can put lidocaine with the epinephrine like this, okay? Just small amount. Some Korean doctors do nerve block, but you know, when you do the nerve block, still you cannot block the more lidocaine, okay? You cannot block the blood vessel, so better use the lidocaine with the epinephrine. Okay? I usually just do quickly without shooting all the lidocaines here, but for your sake, I just put a little bit. Don't put too much, okay? If there is a swelling, the thread will not go into the right layer. Okay, just small amount, you see? Small amount. And not too deep, just superficial. Okay, so we done with the little cane. No, but you can prepare for the other side. Okay, I need somebody to, yeah, okay, thank you. Okay, so this is the cannula, but actually we have a very special design beside other cannula company in Korea. You see this one up to here. Can you see the one line still up to the middle? Most of the other Korean company, the thread up to here, okay? But we have thread specially designed up to here. This is my design, okay? So it will help to lift and make the shape more better. Okay, so always stretch. I told you to stretch, okay? So you have to put the skin in one plane, okay? Stretch. If you don't stretch, what happens? It's something like this, right? So the bulging marionette here. But if you stretch, the skin is in one plane, okay? One straight plane. So it's much easier for you to put. And then now we clean up here. Usually I use the betadine. Don't put the betadine there. Here. We have to put the betadine at the backward. No need to put in the middle. So you clean up here like this. Okay. So we're going to make a puncture, 18G. 18G. So here, 1, 2, 3, and also here, 1, 2, 3. Yeah, so usually 3 punctures. Okay, so now we have a good stretch. And place the cannula when you make a bevel down, go in. And you have to make use of your left hand. So when you are going in initially, you pull this side, okay? Then you have to stretch like this. Stretch and follow right. And sometimes you stretch and sometimes you pull like this. So you have to control the cannula is actually exactly below the skin, okay? They follow the skin layer and they go up to here, okay? Okay. Okay. So again here, go slowly, slowly, and you are here. Can you see you are here already? The end is here. Okay. And then hold gently, hold this cannula, then slowly take out, okay? We need more. Okay, bevel down, go in slowly. Go in slowly. Okay. Okay. Also here, can you pull here? Okay. You know, always Asians, this area is prominent, so it's very difficult to curve and go down. So sometimes then you have to bend the cannula, bevel down, and bend the cannula like this. Can you see it? Bend a little bit, okay? So you bend it a little bit, then you go. And also some patient, if it's too prominent, usually we have to go like this, right? 1, 2, 3, but we go something like this, okay? We deviate the angle, the first one to last one. Yeah. Something like this. So take out slowly, okay? Just do it gently, don't be rush. If you cannot make it, just do it slowly. Okay, again, just do it slowly. Here is the end, right? Can you see the end? So hold it and take out slowly. The mold thread is quite strong, so you have to be careful. Once you make a mistake, sometimes you have some dimpling. But actually, if you have this RF cannula machine, no problem when you have a dimpling. You can solve all the dimpling with the RF cannula machine. So now the third one, we go to the first one, okay? Because our first one go to the second, second one go to the third, now third one go to the first, okay? Okay, here is the end. Okay, so we place the 3. But, you know, we don't pull too much, just make a gentle pulling, okay? Don't pull too much. If you pull too much, initially you will have a big lifting. But, you know, you always have the trouble because you will have, when the patient open the big mouth, eating the meat, and the patient will have a sudden drop down. Okay, so just make it gently, okay, gentle. Still, this will have a long lasting with a natural lifting. Don't worry, okay? I've been doing this more than 10 years. So that's why I mentioned a while ago, no need to have an anchoring, okay? No need. I never need anchoring. So just make a gentle traction, and then you raise up the thread and cut about 0.5 or 1 cm inside. Okay, so gentle, and everything should be very gentle. Okay, go in. Okay, cut. Go in, cut. If you are in a rush, you always have a trouble. And that trouble will make you a big headache. Patient always come back and come back and come back. Then you don't want to do thread lifting. So, looks like, oh, Dr. Kwon, it looks like 2 weeks. You don't pull too much. But I tell you, after 1 month, you will see the patient is very happy. Okay? Okay, so just pull gentle. Okay. And if you can see, you have some dimpling here, right? Dimpling. Immediately after, you have the dimpling, right? Can you see it? So the dimpling, always try to solve immediately as possible. So you hold this area very tight, don't let it move. Hold tight, very tight, press tight, and then you have one new cotton. You're going to do this way with an impact, okay? So 1, 2, 3. 1, 2, 3. 1, 2, 3 with the impact, okay? Then usually the dimpling is gone. Okay, so we are done with the right side. But of course, you know, all the PDO with the cork or mold has its limit, because this effect, the PDO, the cork or mold will melt, then many patients will face the sudden drop down. Give me the tornado. So we do the anchoring not by tying, but we do the anchoring with our collagen stimulating thread. Give me more. Okay. So we do the anchoring with our tornado thread. This is our tornado thread. So, okay. So actually we have to put, this is the thread area, right? The 3 thread is here. So we have to put it here, something like this, 1, 2, 2, 2, 2, 2, like this. So actually, you have seen in the ultra-core, the collagen stimulated by thread or by the PDO, they will last quite longer than you imagine. But if you put it right, okay? Okay, so we're going to do the anchoring this way. So actually, you put the thread here, right? I measure here. Remember here, you see? You measure. That's why you always need to measure. So actually, I'm putting the thread here, exactly where the 3 layer passed. This way. Yeah, okay, thank you. Give me more. So this is, I call it natural anchoring technique. Okay, we don't do any tying. Because in this area, this pattern, the collagen will be stimulated, and once you stimulate the collagen, that collagen will last 6 months to 1 year if you have the good layer, okay? And mono, I need the mono, 30, 40, 30, 850. Yeah, can you bring my luggage? Okay, so something like this. We have a. Okay, so we place 10 thread here. When you take out, always gentle pressure, then rotate a little bit, take out. Okay, no need to rotate like this, but you rotate up and down, shake a little bit and take out, okay? Okay, now the mono on the middle area. We placed the thread here. So we use the short mono. Okay, here. Can you see the mono? Or you can use the 3850 or 3040. So we're going to place here, something like this. So we're going to go down from here. Always make it very superficial, okay? Don't go deep. If you go deep, you don't see the effect of collagen stimulation. So this is the anchoring, okay? Natural anchoring technique. And this will make the thread last quite long, okay? In Korea, so many thread, as you know. So many people said, oh, I used a very strong mold thread, but the effect lasts only 6 months. No matter what you use mint or M finders, whatever you use, they will never last more than 6 months, okay? That's why in Korea there is a rumor. The thread lifting, it looks a good effect, but they don't last more than 6 months. I mean, that rumors came from the patient, not from doctors. So, but when you use this technique, at least you can maintain 1 year, okay? Much longer than those other threads. Like this, very simple. Just put 10 thread and then take out. Okay, we are done with the right side, so we will see the changes. Let her sit up and take a look at them.
So Dr. Kwon, why don't you use the same tornado? Why you use the mono upper and tornado lower?
Because on the middle area is very sensitive, and the tornado is quite. You can use a short tornado on the middle area. Yeah, but it's quite 25G, 26G needle, very painful here, and then too long. So we can
Okay.
use the short mono or short tornado. Take a look at right side and left side.
tornado มันรู้สึกจะ50ด้วย right the tornado the thread is 50
Five size.
Yeah, 50. One side
Yeah.
thicker than the 60.
but mono is 60
ครับ
You see the line is very smooth and more better. And this will last quite long, much longer than you imagine, okay?
Very beautiful.
Yes, that's why I told you it's natural and good lifting and long lasting.
So we need to always do all of the procedure in the same visit, or we can separate the mono or tornado to second visit.
You can separate the cannula and the mono, you can separate, no problem. But the RF cannula and the thread should be at the same time. Yeah, because it's the RF cannula, because you dissect, you made the skin inside loose, right? So you put the cannula at the same time, so it's kind of a fixation. If you do the RF cannula and then you do the thread after 1 week, 2 weeks, no synergistic effect. But you do the RF cannula and you do the thread, the synergistic effect is great. So the result is cannot compare. That's why many of my patients, they went to other Korean famous clinic for the thread, and they do to me, Dr. Kwon, the result is totally different.
Okay.
So if you want to make your result more better, greater, RF cannula, thread, that makes you one step up than the result from other clinics.
For this question, I ask you because you are the owner of the thread. Some doctor concerned about the heat that you deliver it from the Tridem.
Heat,
The heat from Tridem
Yeah.
inside, and after that you insert the thread.
yeah.
Can that heat destroy the thread?
If you do the thread, and let's say 1 month, 2 months, 3 months after you do the cannula, RF cannula, maybe can fasten the absorption. Heat can fast, but actually PDO thread is not much affected, but PCL thread affected by RF cannula more. If you remember the lecture, PCL thread melting point is a 58 to 60 degree. But PDO thread melting point is 105 to 110. So
Okay.
it's not usually affected, but PCL thread is quite affected.
So if you do it together, you just use only PDO, right?
Yeah, no problem, yes.
Yeah. Okay. นะครับก็อาจจะมีหลายคนเคยถามมา
And
นะครับก็เลยถาม
especially
ให้
you do the RF cannula, initially the heat goes up, right? But after 5 minutes, the heat comes down. So actually no problem. Yeah. So I use this RF cannula to solve the problem of the thread. You have the dimpling. Actually, you use this RF cannula to release the dimpling right away. It's like a magic. So this machine has a lot of indications. Okay, so we will do the left side.
Okay.
Otako? So we will do? Okay, no problem, we do.
so we running out of time
Yeah, then,
you have to do quick
okay, so
or you just left the other side undone
Okay.
you can, if you want, just finish, then I will show the ultra core, you can finish, then I can do later.
Yeah, I think,
Yeah, I mean-
I think you show the outer call the same side. And
Okay.
after that, we finish to preparing the hands-on session.
Yes,
I think
yes,
it's
yes.
better.
Okay, so ultra core, we make a puncture. Give me one 20G or. Usually the entry point will be from the corner of the nose, 1 cm, 2 cm. Okay, so we make a puncture here. We must have done ultracore earlier than the thread, but anyway, And this is the ultra core 1cc with a 23G cannula here. Clean up here. I usually use betadine in my clinic, so clean up here. Okay, so let's go inside. Even though this is a cannula, please make a bevel down. And this is the ultra core, so you mix with the sterile distilled water 3cc and Lido FP 1cc. Okay, then this become like a liquid. Yeah, this will become liquid like this. Okay, turbid liquid. Okay, so going in, always superficial. You see superficial? Can you see superficial? Superficial. Just go slowly. It's very easy. Looks in the video you might afraid. Some people are afraid, but actually it's not that difficult. And one thing you have to make sure is you have to go up to the end. You see, you're going to puncture up to here. You see, and then you make a very even. You look at the speed here, even shooting and come down slowly. Usually one line here, I put 0.15. Okay, 1 ml, so 0.15, something like this. And then I go to the 1 cm beside here, another here. You go up to the end. You see, you puncture up to like this. Okay, you almost you can see the cannula here. Okay, so again, just slowly. Don't put too much. Just follow the instruction, then you will never have a problem. Okay, another 0.15. And then here, again, here, right before the tear through, you can control also a little bit. Okay, and then here there is some people have a tear through lines here, right? So right inside, inside the tear through, you should little bit more, and then you go up to here also. Can you see up to here? Shoot very minimal amount slowly, okay? Don't put too much, because this will not have a big bulge. The reason why we shoot up to here is up to here, right? Slowly, because we want to make them stretch like this, okay? They will stretch like this. So because the PDO collagen stimulation have a stretching effect, so you go up to here and slowly shoot again. So here also slowly shoot again, slowly. Actually, if you get used to it, finishing one area just less than 1 minute, okay? Okay, again you come here. So some people with the dark circle sunken, then not here, but here. Can you see the end of the cannula? Here, you shoot little bit more. Yeah, a little bit more. Then you should have a very bright under the eye. Okay, so this is the end. If there is a little bit swelling, just press a little bit gently like this. It's about 10-20 seconds, then finish, okay? Unless you don't put here too much, I told you don't put here too much. If you put too much, there is a bulging, okay? But if you shoot this way, usually you will have almost no bulging. Even you have a bulging very minimal, they will all go away after 1, 2, 3 weeks later. Okay, let's take a look at it. Sit up, please.